Okay, today I drew on the left leg of my patient, and I was just drawing the bony landmarks as well as the muscles and some tendons. So here you can see the tibia. This is the bone that is connecting with the femur. And on the lateral side of the leg, you can see the fibula. So this bone right here, exactly. Up here, you can see the patella. This is the patella tendon, and it sits on top of the femur. And yeah, up here, you can see the quadriceps. This is the biggest muscle of the thigh. If you look onto the patient, you have four muscles that are in the quadriceps, but I only drew three because the muscle vastus intermedius is the deepest muscle, and you can't really see it, or you can feel it. So here you have the vastus medialis. It is a part of the quadriceps, and it starts from up here and it goes down here. And in the middle we have the rectus femoris, and on the lateral side we have the vastus lateralis. Exactly. If the quadriceps contracts, so if there's a contraction, the knee will extend, so it has an impact on the knee, exactly. And if it contracts, the antagonist of this muscle would be the hamstrings, which are on the back of the thigh. Okay, now I'm going to talk about the origins and insertions of the quadriceps muscles. If we're going to take this muscle first, this is the vastus lateralis, and it origins at the greater trochanter at the femur, and it inserts at the tibial tuberosity, which is right here, and you can actually feel it because it sticks out a little bit. Right here we have the vastus medialis, and it origins at the intertrochanteric line, which is also at the femur, and it inserts right here, which is the tibial tuberosity, which is also very, like, you can feel it very good. When we look at the rectus femoris, which is the middle muscle of those two, it inserts in the tibial tuberosity as well, which is here. You can see the insertion in the tendon of this muscle in blue. And it origins at the inferior iliac spine up here all the way. That is not shown from this drawing. But here you can really see the bony landmarks. So if we have the posterior view of my patient, we can see the calf muscles of the left leg, which I was drawing here. And you can see the gastrocnemius up here with two heads. One is the lateral head and the medial head. And the medial head origins from the medial condyle of the femur, which is up here, and the lateral, right here, up here. And the lateral head of the gastrocnemius has the origin at the lateral condyle of the femur. And both insert in the Achilles tendon, which you can see here in purple, which is very large. And this kind of starts at the calcaneus of the foot. And here you can see, kind of because it's like more deep, this muscle, it's called the soleus. This is also a calf muscle, and it also inserts at the calcaneus. Yeah, this is all for the leg, the knee, and the lower leg for the anatomy part. While drawing on the patient, I really noticed that it's very hard to palpate or to draw accurate lines by palpating the muscles, because every muscle is really close to each other. So sometimes it was very hard for me to really find a good line that shows the different muscles. Therefore, I really left out a bunch of muscles that we have in our leg, but therefore I only focused on the quadriceps, which is the biggest and most superior muscle from the upper leg. But I am aware that there are more muscles in the leg, such as the adductors and abductors. So that I definitely left out from drawing on the leg. Also, the knee has a bunch of more structures that are very important, such as all the ligaments, for example, the medial collateral ligament as well as the lateral collateral ligament, but also the PCL and ACL. I couldn't really draw that. But I'm definitely aware of all those structures, but this video is mostly about showing the general structures of the leg, and I hope this is giving a good overview of my knowledge of the anatomy of the leg.